50 for 50, day 48. It's raining, but day 2 A&E.
I've been on A&E this last week, and one of the most important skills I've learnt about is clerking patients. Thankfully, I've been with such an elite doctor and he's talked me through everything, and it's been an enjoyable journey so far. So whenever you come into A&E, you need to be seen by a doctor, and they basically get an understanding of really what's brought you in. So they do two main things to bring you into their team. First of all, they need to gather a good history from you. What's brought you in, what's been going on so far. Then they examine you, see what your baselines are like. And these are all skills that we've learned throughout 3rd, 4th and 5th year of med school. And it's all about just bringing it all together and taking responsibility whilst doing that. He's obviously been shadowing me whilst I've been doing this. Before we go and see the patient, we start off by just having a brief read through their notes, get a general understanding of what's been going on, because the notes does tell you a lot of information. Also see what they've come in with quite recently as well, just see if is it maybe because of something that's happened before. Have they come in a couple of days ago for the same thing basically, which actually happens quite a lot. Literally in the last 2 days I think I've had that twice. And then maybe having a look at a lot of the investigations that have been done so far, so things like their basic observations, the temperature, the blood pressure, the oxygen sats, if any bloods have been done already for the patient. ECGs are usually done as well before we go to see them. Having a brief read of the information that we have from the patient before we go to see them is very important. And then come speaking to the patient. So we gather a good history, literally basic OSCE level stuff. Take a history from the patient, history of presenting complaint, the presenting complaint, past medical history, and so on and so forth. And then do any examinations that are relevant to the history. And luckily, just by getting this practice in, maybe just doing one a day, honestly, one patient a day is more than enough. You get practice of your history, you get practice of your examinations. When it comes to the OSCEs, you'll be completely fine. We've got this new thing in our OSCEs now in 5th year exams, in our 5th year OSCEs, where they'll give you a history and an examination to do, or some sort of clinical skill to do within the 10 or 12 minutes that we're usually given to do the whole history or whole examination. So you've got to be a lot more quicker and you've got to be a lot more slicker. So getting this practice in very early on, honestly, it's going to be very, very useful and you won't regret it. And it's quite cool just going through the management plan afterwards with the doctor. He then talks you through it. He then got me to speak to the consultant, present all my findings to the consultant, spoke about a management plan, ordered any imaging that we thought was relevant, then looked at the images together afterwards, spoke to the consultant, decided on a management plan, then went back to speak to the patient. If we were happy with it, we then discharged the patient and they'd end up going home. Man, it's been fun, man. Just seeing it all come together right from the start all the way till the end has been quite enjoyable.